Welcome to The Sensitive One. I'm Gina Susan Long, nutritionist for highly sensitive people, and today I'm speaking with registered nurse and integrative psychotherapist Lyndsy Chavarria. Lyndsy has a lot of experience working in healthcare as well as with her own health experiences, some of which you will hear about in this interview. As a result, she enjoys working with clients who have chronic illnesses. I'm a big advocate for integration when it comes to mental and physical health, and with Lynsy's interest in chronic health challenges, I was really looking forward to speaking with her and getting her perspectives about dealing with the changes and challenges that come with food reactions and other health challenges, not just on a physical level, but on an emotional, mental, and psychological one too. Any health challenge, whether it's severe food reactions or something else, ultimately changes who we are. And Lyndsy understands this and helps her clients to work through it. Today, she's sharing her invaluable personal experiences and insights with us. So I will hand over to Lyndsy now, and I will see you on the other side.
So my name is Lyndsy Chavarria. I'm a registered nurse and licensed professional counselor in Colorado. I consider myself an integrative psychotherapist. So what that means to me is I really take a whole mind-body approach to mental health. So I primarily specialize in perinatal mental health and also chronic illnesses. And a lot of times people think, wow, those things don't seem to mix. But actually there's a lot of overlap. So, I see a lot of people with allergies, food intolerances, and just the whole spectrum of chronic illnesses. And then also, a lot of times, the individuals, the adults that I see have kids with special needs, and they may also have, medical needs or chronic illnesses.
That's really interesting, and that's something that I wanted to ask you about
hmm
first off, because I think it's well known that becoming a parent or having another child can trigger things like postnatal depression for a woman
Yeah.
as well as for a man.
hmm
And, that happens for a number of reasons. There's lots of very obvious reasons. So, hormonal changes, sleep deprivation,
hmm
financial stress,
hmm
all kinds of things. And then when you add to that, becoming a parent of a child who has problems, so whether it's allergic type issues or if it's a child with special needs, that adds a whole other layer to the struggles and normal stresses of parenthood. So I have no doubt that that can make parents even more vulnerable to mental and emotional struggles.
Yes, absolutely.
So what impact do you think having a child who has food allergies, for example, has on parents' mental health?
Yeah, I think, I mean, it depends, of course, depending on, the severity of whatever it is the child might have. But there's a variety. We see, a lot of trauma. Sometimes there's really scary instances that they get into, emergency situations. Child has to be hospitalized, things like that. So we're seeing a lot of trauma or acute stress, a lot of chronic issues, so depression, anxiety, really the whole gamut of mental health struggles.
You had an experience of becoming a parent and developing mental health issues, I think you said on your
Mhm,
website.
mhm.
Can you tell us about that? So, what actually happened with you?
Yeah, of course. So, like I said, I'm a registered nurse. So I have been a nurse for many, many years. I was a nurse at the time my oldest son was born. My oldest was very sensitive, very colicky, very, very hard baby. I would say for the first almost 6 months. So it was a struggle. I really suffered with some depression and anxiety. Scary thoughts, had trouble sleeping, and I found myself, having a hard time finding support and resources. And once I did find support and resources, there was other barriers that were in the way, such as, financial concerns, clinicians that didn't take my insurance and things like that. And you think you have some level of education, you think you have some level of support. I thought so anyway. And then you have that experience and you realize it, it's totally different. Just knowing things logically doesn't mean you won't have maybe a so called negative experience.
And what kind of support did you seek, or what was it that you found difficult to get help with at that time?
Well, and I would say, first off, I didn't seek support. And I think that has a lot to do, with our society and our culture. We're supposed to be able to handle it and do all of the things and manage all of that. And finally, I think I probably talked to my husband and talked to some friends. I had a women's support group that I reached out to, so I started putting those things in place. I got a therapist, and then worked through all of that. And probably by the time he was about 18 months, I would say I felt pretty good and pretty close to what I would call normal
Yeah.
again.
So it's pretty stressful when you've got a baby that's probably upset and crying all the time. And that would have had a big effect on your mental health. And then, as you say, yeah, people do often find it difficult to ask for help. And I think one of the reasons is potentially, and I hear this a lot, that new parents in particular, for one, I guess you don't really know what's normal. And then secondly, you do often get this really negative feedback from the people that you seek help from for the child, where they'll say things like, oh, you're just a new mum, this is normal for babies to cry, that kind of thing. Does that resonate with you?
Yes, absolutely. Yep. And you read all the books, right? And all these books are supposed to tell you what to do, and then you do what all the books are saying, and nothing's helping, nothing's working, right? So then you feel kind of really lost and alone, I think, and it's very disorienting, I found for myself. And then, you being a nutritionist, right? Talking about eating right and sleeping right, like those are the foundation for our mental health, and of course those things were kind of out the window too.
So it was just a cluster of stresses that were just too difficult to handle on your own. I mean, we shouldn't really be dealing with these things on our own anyway, should we?
Exactly. Yes. No, we're not meant to do that for sure.
And so, what kind of resources are available to parents who are going through this kind of thing, where they've got a baby that's experiencing tummy pains and colic and is crying all the time? I know you said that at the time there was little support for what you were going through. Has that changed?
Mhm. I think it's changed some. So, and I don't know if I told you this last time or not. So, what I originally found was Postpartum Support International. I don't know if you're familiar with that at all, but it's an international organization that's for moms and families, that provides various resources. So they have like a clinician directory, they have free online groups and things like that. And they were really my first lifeline. I think that I found where I started going, oh, hey, I'm not alone. Other people go through this too, and not just moms, parents. It could even be a different caregiver, it can be adoptive parents. So I've been pretty much ever since then involved with PSI in some way or another. Right now, I'm on their Colorado chapter advisory board. So I'm very passionate about the perinatal piece. And then also, again, like a lot of the moms I see, they also have chronic illness, infertility. So I see a lot of people come in with infertility, PCOS, those types of things. And so again, it's like this whole picture, having my nursing background, the mental health background, all of those pieces are very, very important for me when we're talking about therapy and mental health treatment.
So you said that you also work with adults who have food reactions and chronic medical issues. Can you tell us a bit more about what kinds of concerns people come in with when they're living with serious food allergies, for example?
A lot of the concerns I see are related to identity, maybe. So maybe someone has like a severe and life altering change in how they function because of their illness. And so they don't really know who they are anymore. There's like this person before the illness and then this person now. And that's really hard to reconcile sometimes.
Yeah, what kind of things change for people with their identity? Is it because of the fact that they feel their bodies have failed them in a way, or they no longer can trust their bodies, or is it also to do with things like changes to their ability to socialize in the way that they used to because of having to be more cautious about where they eat, for example?
I would say all of those things. Yep, definitely physical changes, changes in their abilities, even changes in their relationships. I would say, even for myself, like I'm probably not the same person I was before I had, a really big change in my health a couple years ago. So that impacts not only the person, but the people around them. Like whether we want it to or not, it does.
Yeah, I very much relate to that as well. With my experience with chronic illness and particularly severe food intolerance, which was something that it sort of happened overnight for me. So it was a very, very life changing experience. And yes, yeah, it does. It affects everybody. Yeah. So, what was your experience with that?
Mhm. Yeah, so I guess a little bit about my story. I'll try to be succinct. So I've had, I would say, lifelong sensitivities, issues, concerns. I mean, I remember being a child and not being able to walk down the detergent aisle because I was very sensitive to the smell. I would get headaches, sensitive to medications. I don't know if you want this information, if it's TMI for your podcast, but you know, um, very painful, heavy periods, things like that, tinnitus, joint pain. I mean, the list goes on, right? And along with, some mental health concerns too, starting probably when I was a teenager. And I would go to the doctor regularly, check in, let them know about all these things. And as you probably well know, nothing shows up on paper, right? Your labs look fine, everything looks fine. You're too young for this, all of those invalidating stories, right? Where you begin to think, okay, am I crazy? And then I'm, a nurse, a medical professional, and I have medical professionals telling me these things. So that really creates this weird dynamic. And so a couple years ago, when I was actually at the Postpartum Support International Conference in Houston, and I had mild seasonal allergies and things like that in the past, but nothing severe, and had a very severe allergic reaction while I was out at lunch one day. And that day, my life changed. So after that, I could not fly home. So we were in Houston flying back to Denver. I couldn't get on a plane. I was having very severe panic attacks, still reactive physically, living on Benadryl essentially for the rest of the weekend just to get me through. Made it back home and had, multiple ER visits, urgent care visits, hospital stays, specialist after specialist. And I'm sure you've probably heard, similar stories. And I was, pretty much bedbound for 4 months, took a leave of absence from my job. And my mom came to stay with us and help us with the kids. It was pretty terrifying and traumatic, and so that takes a lot to heal from that, re-regulate your nervous system, figure out really what's going on, and get to what is my new normal gonna be. I had lost a significant amount of weight.
What did you react to?
So they think I had like a variety of foods, which were super high histamine to begin with, so I didn't know that. Even being a nurse, I had probably one nutrition class, right, in all of my training. So nutrition was definitely not my strong suit at the time. But I had, and here's the piece where I tell people to really trust your instincts. So I had a variety of foods. I had a piece of, I don't even know what they were called, but there was some caviar on top of something. And I was not going to eat the caviar. I went to brush it off of my plate with my fork, and it kind of stuck, like it didn't come off. And I thought, oh my goodness, you're here with your friends, you're here having a good time, live a little, have fun, eat the caviar, right? And minutes later, it was just a bad deal. So I was originally diagnosed with like a ciguatera or scombroid food poisoning, which pretty much exacerbated all of these underlying conditions that I've had for years that have never been officially diagnosed.
Okay, so it was sort of a eating spoiled food that
Mhm.
caused this reaction. And I don't know if other people are familiar with this, but particularly with seafood, it can cause severe reactions if it is not fresh enough and there's a buildup of histamine.
Yes. Hmm.
Wow,
Yes,
so that really knocked you.
it did. Yes. And from
Yeah.
what I learned was that I'm forgetting even what it's called, but the caviar, like it's very concentrated. So I got super dosed with a toxic amount of, yeah, histamine. Hmm.
It took you 4 months to start to recover and
Hmm.
get back on your feet?
Yeah. Yep. And that was, until I would say I was maybe 60 to 75% functioning at that point, like where I could just start, getting back into a normal routine, taking care of the kids, getting them to and from school, getting back into work and just on a part-time basis kind of thing. I think those things change you and say, what I hear from my clients too is you look at the world differently. I think when you have severe reactions like that, not everyone I see has anaphylactic or similar reactions, but a lot of them do. And again, it's one of those things that you can know on a cognitive level, but once you experience it, there's almost not words to describe that. And so definitely changed my outlook on a lot of things, changed again the relationship piece, and just I think I would say it changed me as a person. I definitely had, I guess, a different perspective, I would say, for people with chronic illness.
I think what you were saying about how having a severe reaction, like an allergic reaction or something like that, can change your outlook on your environment. I relate to that due to having severe food intolerances. Because all of a sudden, you have to think about everything. And I've gotten to points where I wasn't sure what I could eat without reacting because it got so bad. And that kind of thing, like
Mhm.
it's like food is your survival. It's your connection to the world and also to other people. That's a that's another piece. But just talking about survival itself and taking that away from someone and that now becoming a threat, I think has such a massive effect on your outlook on the world and your sense of safety. And you do become more hypervigilant, for example.
Yeah, absolutely. Yeah, you can't, I mean, and a lot of people like myself with food intolerances, like there's some days, things are okay, right? And then, as you know, hormones play a big piece. If my hormones are not in balance, I might have something today that I react to that, maybe I didn't react to yesterday. And so it's just this, it feels like Russian roulette almost. And with food, like you said, we need food to survive. And so it's just this weird, I'm not sure what the word I'm looking for is, like maybe a dichotomy or to you have to eat to live, but you're probably really afraid to eat because you don't know how that's going to impact you.
I'm in a number of support groups for people with food allergies and intolerances, and I do see a lot of people saying that they're afraid to eat because they don't know what they're reacting to, and that's a really awful place to be in. I know what that place is like, and they're hungry. So yeah,
Of course. Yeah.
it's a
Yeah.
very weird dichotomy. And I think something else that you mentioned with people who are living with life-threatening anaphylaxis is that they can find themselves also now facing existential questions. Can you talk about that?
Sure. So I guess I'll start with me because that's what, my experience, and then kind of bring it out from there. But yeah, that existential piece of asking yourself, what's important now? Um, that's one of the big questions. I don't like to say leaving a legacy because that sounds like I want to be like really popular and like, something like that. But in terms of your family, like what do I want my family to remember about me? Are they, I have two young boys. My oldest is 11, and my youngest is 7, and he has autism, of course. And we know, I don't want to go too off track, but we know all of these things are connected. But that's like one of the first things I started thinking about is I had this traumatic experience. I don't want my kids to have to witness a traumatic experience. Like, what if something happens to me and they need to call 911 or something like that? So a lot of those kinds of things when we're talking about the life-threatening stuff tends to end up in that trauma realm.
I thought it was interesting that you've worked in palliative care. So you've worked with people who are actually facing death. Has that kind of fed into, how you help people who are living with a life-threatening condition like a food allergy, who are facing an existential crisis or existential questions?
So when I was working in hospice, in palliative type care, the majority of the patients were, elderly, so older. So it's not that unusual, right, that we would think that they were close to their end of life. And then, so I'm in my 30s, and then I'm having this, enlightening moment like, oh, I could die tomorrow. I could die today. And I think it just makes you, well, at least for me, makes you pause a little bit. I think it can be helpful to really make sure you're in line with your values, doing things you want to do, like this podcast. Like I, have a lot of compassion and love for this topic and these people and this information. And I don't want people to ever feel like they're alone. I don't want people to feel like they're not understood. Like all of these things that I experienced with this, fear of dying, all of these things are real, and people aren't crazy. They're they're experiencing these things. They're having trauma responses. The other thing with that is there's a lot of grief and loss. So even if we're not talking about grief and loss of a person, you know, we don't talk about death a lot, right? It's one of those things like if we don't talk about it, it doesn't exist, right? Or I'm not sure what it is, but I think it's important to talk about that sometimes. And there's grief and loss not only like with the potential, like, yeah, we are all going to die at some point, but the grief and loss again of who I used to be, who I thought I was, this safety or this perceived safety that I thought I was living in.
In particular, if you're a young person as well, sort of losing the life that you believed or hoped that you would have. So a future, I think an imagined future.
Yeah, yes, exactly. Yep. Yeah, that ambiguous grief or that ambiguous loss. Yep.
I think for me, it was just you take for granted your health and your ability to do things, to eat what you want and go where you want to go, to have that kind of freedom. And then when that suddenly disappears overnight, you kind of have to, well, for me, it was a shock. It felt like a nightmare. I couldn't believe what was happening to me. But then, yes, I think for me, probably grief didn't come until a lot later in my life, because I was so busy dealing with what was happening that I wasn't able to really, like, feel sad about it. But, yeah, I think for me, it's been now that I'm older, more so looking back on kind of the loss of my youth, because I was very young when that happened to me. I was probably about 20, and I lost I lost friendships. I had to move on from friendships that just no longer were in alignment with what I needed for my health. And because of just a change in my thinking and the things I valued. So there is like a kind of a loss of freedom and um, carefreeness. I don't know if that's a word.
We'll make it a word. Exactly. I think like you said, that's really hard. And I don't think you deal with the grief at the time, right? Because you're in survival mode and you're just trying to figure things out. And if anything, a lot of times people will be angry. Anger is what comes out first. And I don't know if you've heard of like the anger iceberg, right? But so the anger is like the tip that we see, but underneath that is all of that fear and that struggle and that sadness and that worry and that hurt and that da 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 da, like on and on, right? So those are tied to that anger, but those don't always come out right away until later. But yes, as far as the relationship piece, I think you nailed it on the head. And I hear that probably with most of my clients. I've lost friendships. I've known others that have lost friendships, or even sometimes family relationships. And it is hard, it is painful. And you have to ask that question, like, what is serving me? Like, is this in line with my values right now? Is this a helpful relationship for me? Is this person, we call it like a heater or a cooler? Are they draining my energy, or are they feeding, helping me? Those kinds of things. So yeah.
When you're in a situation like that where you kind of can't help what is happening to you, and you're at the mercy of people in your life as to whether they're going to be understanding,
Mhm.
or whether they're going to be dismissive or rejecting. And sometimes I do think it can filter out people that perhaps aren't the best people to have in your life, because it really tests our relationships with people as to the resilience of them. And I think that if you come through it, you can actually find that you develop more authentic relationships with people that will be with you through difficult times. Because I think that's the thing, if people aren't going to be able to stand by you when you're going through something like this, then what's the point? Because that's what relationships are all about.
Yes, yes. And that's the kind of support you need too, when you're going through some type of chronic illness. I don't know if you talk about spoon theory ever, right? But some people who have, say, chronic fatigue, or, just really have troubles with their energy levels, we don't need those people in our life that suck all that energy out of us. Like, it takes enough already. So, yeah, absolutely.
The other thing that I think happened for me, going back to the grief and loss part of this, and also kind of a relationship, was because I had really bad experiences with seeking help from doctors. And before this, I had this very naive belief that if something was going wrong with me, that the doctor would know what to do and they would fix it. And because that didn't happen at all, and because, I was dismissed, I wasn't believed, I was labeled a hypochondriac, I lost trust in the medical system. And that was actually a big loss for me.
Yeah. Yeah, and I would agree with that too. And a very different perspective for me. And again, I think that kind of goes back to that identity piece. Like, I'm a nurse. I've been in this medical system a good chunk of my life. And I'm probably not proud of it, but I probably have been that person who was dismissive to a client or a patient, Again, because I didn't know or I didn't understand. A lot of times I think they teach you in medical school and nursing school, we're supposed to fit people into categories or into boxes, right? We do all these labs, we do this workup, we take X-rays, all of this stuff, and we come up with a diagnosis. And when that doesn't happen, then we go, oh, well, then you go into the mental illness box, right? I don't know what the percentage is. I think I read this somewhere, and I don't even know if this is true or how you could even figure it out, but something like 90% of people with chronic illnesses are diagnosed with a mental health or a mental health diagnosis first. Like, don't quote me because I don't even remember where I saw or heard that. But I would say that's true, at least anecdotally, for what I see in my practice. Um,
Going back to the idea of categorizing things, you mentioned earlier something about being told you were too young for, this problem or something like that. I had that happen to me. So I was having gallbladder attacks because I had gallstones when I was about 20. And, because I didn't fit the picture, and you know what the picture is. What is it? Fair, fat, 40, something like that, female. Um, because I didn't fit that picture, because I was slim, I was 20, I diagnosed myself eventually, and I went for an ultrasound to confirm, what I thought was happening. And the ultrasound technician just took one look at me and said, "You're too young to have
hmm.
gallstones." So I think that the fact that there is this categorization prevented, me from being diagnosed properly, because I had been to hospital, I'd been in the emergency ward in pain, and nobody had actually done the proper tests to figure out if I had
Hmm.
gallstones. So, yes. Does that make sense?
Yeah, I mean, I understand what you're saying, but it doesn't make sense, right? Like in our medicalized system, the what I keep coming back to is, so they did these things and they didn't find a problem, and so okay, you're fine, or it's a mental health issue, right? No, like, why do we stop there? That is what doesn't make sense to me. Why do we stop? Like, we need to keep looking. And sometimes that gets us into where you're being bounced around from specialist to specialist to specialist. So I can understand, like, that piece is frustrating as well. um, but I mean, it can be probably pretty dangerous in your case, I would think, if you were to have just went home, and been like, oh, okay, I'm fine, the doctor said I was fine. um, you mentioned trust. That comes up a lot in session too. Like you said, we're supposed to be able to trust our medical providers. And I'm not saying, don't ever trust your medical providers or anything like that. But I'm also saying trust yourself, or find a team that you do trust. Like, don't quit if you're still having symptoms, if you know, like, intuitively something is wrong here. Like, not being afraid to advocate for yourself, and like you did, educated yourself and figured out, okay, I think this is what's going on here.
Yes, I think you can start off a journey like this, um, sort of being in a position of acceptance and trust of what you're told. And I certainly think that people's cultural backgrounds and, cultural ideas around authority, and also potentially being a woman, I don't know if that has an effect, gender has an effect on that. I was taught to just trust authority and respect authority, but I think that journey kind of took me on a path towards sort of, realizing that that wasn't necessarily going to work, and I was going to have to question things more. And, I still find it difficult when I see a doctor to question them. I still find that difficult, and I think that's a personality thing as well. It's, some people just come to this being more outspoken, whereas others are more kind of shy, or they don't like conflict. I think that's what it is. You're right. we do need to advocate for ourselves. And I think it's great if we can have somebody who advocates for us,
Mhm.
particularly when we're in a vulnerable position. So whether that's, a family member, or a partner or a friend,
Mhm.
or even a counselor. I
Yeah.
think a counselor, if no one else.
Yeah. Yep, absolutely. And I always offer that to all of my clients. So, of course, with a release of information, I think it's really important for clinicians, doctors, naturopaths, chiropractor, whomever it is that's on your team, to coordinate care when necessary, when it's needed. So everybody's on the same page and, you know, um, doing what's best for that client.
Yeah. Yeah, and I think sometimes, unfortunately, having the advocacy of a health practitioner or, a counselor may be the only advocacy that somebody will find, as sad as it is. Because I know that many people who are in this position, for example, with multiple chemical sensitivity or, whether it is food intolerances and or other chronic illnesses that are not well defined, they often don't get sympathy from family or understanding because people don't always understand these conditions and sometimes have trouble, I think, believing them.
Yes. Yes, absolutely. Still sometimes I'm like, even with myself, I'm like, is this for real? Like, does this really happen to people? Like, you question yourself. And I think some of that does come from people don't understand. It's one of those things where if you don't experience it, you can try to understand, you can listen, you can empathize, but you're not experience it. You're not experiencing it. You're not living it all day, every day. So it's different. And we do hear like those terms, invisible illness comes up a lot, right?
Yeah, the fact that you can't see it, I think, when we're talking about food reactions, unless it's a rash or it's full-blown anaphylaxis, you can't necessarily see it. And, if somebody has a food allergy, of course, they're trying to avoid anaphylaxis, so, we're not necessarily going to witness that. So it's difficult for people to process and understand, the severity of it, or how that internal experience is affecting the person.
And I think people, even people who are well meaning, really care about you, are close to you, again, if they don't understand, like they want to fix it, they want to make it better. Their reaction most of the time is to want to fix things. And maybe they can't fix it. Maybe you just need them to sit there with you or just listen to them. And so that's, again, that's like you need to have that communication with people. Um, what are you needing?
Yeah.
So,
Yeah, absolutely. I think a lot of people struggle to deal with something that they can't fix, so it kind of tests the people around us as well, as to how they're going to cope.
mhm.
And I think that that is the best advice. If you do have someone in your life who has some kind of chronic food reactions or chronic illness, to just ask them, "What do you need?" Or if you're
Mhm.
on, the receiving end, is to ask for what you need, which can be very difficult for some people.
It is very difficult. I even it may sound silly, but I even use like this template that we will sit in therapy and talk about. So if there's certain instances or situations where someone might be really anxious or really stressed out, or maybe they're really sad and have trouble getting out of bed, whatever mental health struggles they're having related to their chronic illness. So we kind of go through and list those. So like an example would be, when I'm going to eat at a restaurant, I start to feel really anxious and nervous and fearful or whatever it is. And I need, so we use like that template, like beforehand, we come up with that script, naming the situation, naming the feeling, and then what do you need in that moment? Or it could be like you mentioned, going to the doctor. When I go to the doctor, I feel overwhelmed and nervous, and I need to write down a list of what I want to talk about, you know.
Yeah.
So those kinds of things can be helpful sometimes.
Going back to that piece about going to see the doctor,
Mhm.
is there anything in particular you would advise people to do who do get overwhelmed in that situation?
Mhm. So I think, like you said, if you can bring a support person, that's great. The more preparation I think you can do, the better. And then also knowing that even if we do all the preparation in the world, we still can't control that outcome. So, kind of letting go of that outcome, taking what was helpful and leaving the rest, and coming up with, prioritizing that list. Like, if you have 10 things you want to talk about, like, okay, what are the most important? Sometimes it's calling ahead and going, okay, how long do I have in this appointment? Do I have 15 minutes, 20 minutes, 30 minutes? Can I have a longer appointment? You'll be surprised. I've asked for that myself, and they'll say, yeah, we'll put you in at the end of the day and you can have like that 45 minutes. That's not always going to happen, but I say always ask. It doesn't hurt to ask. Ask for what your needs are. I think that's really important. The answer isn't always what we want it to be, again, but like empowering clients, empowering yourself to get your needs met. This is your health. And I always say, like, these medical professionals or whoever we're seeing, they're working for you.
Yeah. So, why don't we talk a bit more about the medical system and how that can impact people? Because I live in Australia and you're in the US, so we have different medical systems. But I think the problems and limitations of medical systems definitely have a very direct impact on us as individuals. So, how well we're able to cope with the medical conditions that we're dealing with, as well as what the overall impact is on our mental health. And in your country, certain medications, or maybe all medications, aren't subsidized. So EpiPens can be very expensive, and these are life saving devices. So, how do things like that impact people who are living with food allergies in the US?
Yeah, I mean, you're right. I think things have gotten better recently, but again, I can't speak for everybody. I'm sure that there's people who still have insurance plans or maybe don't have insurance to cover EpiPens or whatever life saving medications they may need. I mean, obviously, that's super stressful, right? Like, they find themselves like in this rock in a hard place position, right? Like, do I get my EpiPen or do I feed my family this week? There are these impossible decisions, which of course are stressful, or of course are a strain on mental health and feed into poor sleeping, poor eating habits. And there's barriers, and that's only one barrier. I'm sure there's a lot of barriers, but yeah, the medical system is a challenge to navigate for sure when you have, it's not like a one time thing. This is ongoing. You're going to continue to need medications or supplements or treatments or whatever it is that's helping you function the best that you can.
Do you think that people with medical problems are more likely to be misdiagnosed if they have a history of mental illness?
I would say yes. Obviously, I don't have the evidence on that. Haven't done, research or study, but I would say definitely, yeah. So here's kind of the two sides of the coins when we're talking about like labeling and diagnosing, right? So someone comes into my office and they may have, depression, anxiety, whatever mental health diagnosis that they have. It may be helpful and useful for them in some ways to go, oh, okay, I have a little bit of an understanding of what's going on with me now. So I have maybe a little bit of an idea of a direction to go in to treat it. But you have carry that same diagnosis into a medical setting, and there could be potential for that medical diagnosis being missed or dismissed, right? Or misdiagnosed or whatever it is, right?
Yeah, because I always wonder if that was one of the reasons why that happened to me, because I had previously seen my doctor because of anxiety, and then subsequently, I developed a lot of health problems, a couple of years after that. So because, I had that in my history, I did wonder if that was one of the reasons why I wasn't really taken seriously. So who knows? We don't, as you say, we don't really know for sure. And I'm not against medicine, when I say all these things. Unfortunately, there are limitations, and when you're working in a medical setting, there are things like compassion fatigue, and there's a lot of pressures that are put on people who are working in hospitals and medical centers. Maybe you can speak about that. Why do you think that people do get dismissed?
Yeah, I think that is definitely a big part of it. We were talking about earlier, like how long does the patient have for an appointment? If you have 15 minutes, I mean, that's not nearly long enough, especially if you have someone who has a complicated history to go through all of their, medical symptoms, their history, what's going on with them. Um, and so we do get stuck in this place where you just the patient walks in, you have that 15 minutes and they're okay, well, here, take this pill, right, for these symptoms. There's no digging deeper a lot of times. Maybe we'll do a few labs or do things here and there, but unless it's like really, really severe, yeah, like doctors or physician's assistants or whoever it is that you're seeing, they are, up against some odds when they're treating their patients, for sure. Again, like you were talking about, something being wrong with you, and that's not entirely true, right? Like we think, oh, the problem is me, I'm broken. We may have some things wrong with us. Our body may not be working like 100%. It might not be 100% functional or the way we want it to work. But there's also problems with our systems, right? We don't have the support, we don't have the integration of medical and mental health. Um, System doesn't work optimally, we're not going to get optimal answers and treatment and help. And I think a lot of medical providers, they do care about their patients. It's not for lack of caring, it's not for lack of trying necessarily. It's maybe a lack of understanding or a lack of scope or a lack of ability within wherever it is that they work. So, yeah, I don't want to sound like you said, I'm not bashing or shaming anyone in particular. I mean, I'm sure we come across, a provider that's not a good fit for us. But yeah,
You have a background in health science and you're also a counselor, and you said that you use your knowledge of both the physical body and mental health to assist people who are dealing with, medical problems and mental illness. Do you think that, for example, that there is a bidirectional relationship between allergies and anxiety? And would you be able to talk about that?
yes, absolutely. 100%. And I probably can't talk about like all of the inner workings maybe as much as you can even. You probably are more studied in that, but yes, there definitely is a correlation. And so one of the funny things that I learned throughout all of this, so we have a medication here called Atarax, and it's an old antihistamine basically, and we give that for anxiety. It's not a benzodiazepine, which is, a controlled substance, which is also used a lot for anxiety. But, a lot of doctors are hesitant to prescribe them for various reasons. So a lot of times I would find doctors prescribing Atarax. And I was like, wow, why does that work for anxiety? Like I never really thought about it really. It's like, oh, they're prescribed that, you give it, that's it, right? And then now it's like that aha moment, right? Like, oh, that makes sense. The histamine, in our gut and in our brain, all of this is impacting our mood. And of course, if we block those receptors, that's going to have an impact. So,
So I think a lot of people don't understand that histamine is actually something that acts like a neurotransmitter in the body, and it's very stimulating. And, of course, histamine is released when we have allergic reactions. And also, there are certain people who have histamine intolerance where they don't metabolize histamine very well, and it builds up in the body to very high levels. And as you're saying, it's related to anxiety. It can trigger anxiety.
Yeah, absolutely. And that's, one of the first things I will say to clients when they're coming in or when we're just doing a phone consultation. And even on my website, like I'm pretty upfront. And again, like I am not the expert on all of this. I'm not a dietitian or nutritionist or anything like that. But it is important to, know a little bit of basic knowledge about, histamine and hormones and all of those kinds of things and how they impact our mood, because that's a big, like if we're just throwing that out the window and not treating that piece, like we're missing a big chunk, and we could really be, clients could really be missing out on a big piece of their healing if that's something that they need. It might not be for everybody, of course, but I see a lot of women, I'll say my age, right, but middle-aged women, and these intolerances, sensitivities are very prevalent, I think you said earlier, in this demographic. Yeah.
And it is, it's so, I think it's so helpful to understand the physical aspect of, how that is affecting your mental health. And I know a lot of people who are dealing with these problems notice that connection and they want to understand it. And I think that it's also part of maybe healing that distress or the trauma that is caused when people say things like, oh, maybe it's in your head. So trying to actually
Mhm. It's
understand.
it's just anxiety is what I hear a lot of times.
Yeah, it's just anxiety. And I think that understanding that, so actually understanding for yourself how that physical component works, and that it is a real thing, it's a real biochemical process that's happening in your body that may be a result of allergies or histamine intolerance, and that it is impacting your mental health, and it can cause you to feel more anxious or to have trouble sleeping, etc. I do think it helps to heal that, those questions that we often have of ourselves when we have heard that so many times.
Yeah. Yeah. And it's hard too, I think, to identify. um it's kind of like one of those, is it the chicken or the egg, which came first? Did I have these physical issues? Do I and what I do with a lot of things is like it can be both. Like it doesn't have to be one or the other. It's not all black or white. We can have both of these things, and both need to be treated.
Mm. Yeah, absolutely, and that's so true for issues like histamine intolerance or even allergies or um, mast cell activating disorder. So we've got people who are feeling stressed, and the stress is also then contributing to the allergy. I agree with you. I think that we need to look at both. And it is difficult to pick these things apart. You can't because they're intertwined with each other. I think that going through any kind of chronic health problem or living with something like celiac disease or food allergies or severe food intolerances can be a really deeply transformative experience. And it can be, as we've discussed, both injurious and wounding, but also potentially growth promoting. Do you ever find that people do find growth through these experiences? And, what kind of growth do they find?
Yeah, 100%. I think I find that people are very resilient, I would say. It's all about making meaning. I talk a lot about making meaning, right? So, like, I don't want my experience to have been for nothing. So, again, why I'm sitting here doing a podcast with you, right? One of the first things that I did, so I of course had my own therapist when I was finally well enough to have a therapist and, go out and do things. And that's one of the first things we talked about as well, is like, how am I going to make meaning out of this? How am I going to reconcile all of this, like you said, injurious things that have happened to me, this trauma? What am I going to do with that? How am I going to take that and let it propel me forward into something bigger, right? So one of the first things I did was I created a chronic illness consultation group for any practitioners, just locally here in Colorado. And originally when I put the word out there, I was like, maybe people will want to meet every few months or whatever, I'm open. And immediately I got a lot of interest. We meet every month. It's a great, amazing, dynamic group. So we have, nutritionists and psychiatrists. Really, anybody is welcome. Anybody who treats people with chronic illnesses is welcome, because I think it's a specialized field, and it's really important that we talk about all of the nuances with people who have these chronic conditions, no matter where you're treating them. So again, yes, I do think it's transformative.
Well, it would be wonderful if more people could do that. So more, I guess you would call it allied health
Mhm.
practitioners could get together and, talk about these issues and support each other and offer referrals. That's such a great idea. I'm glad that this moved you to do that.
Yeah, thank you. And I think people with, chronic illness, or people who have had a severe and life-threatening allergy or whatever it may be, like you said, I think there's definitely times where there's, that darkness, that pain, that, really tough time they're going through. It almost reminds me of the caterpillar emerging out as a butterfly, or, whatever analogy that speaks to you, but something like that, right? It's a painful process, but man, can it be beautiful, whatever comes out on the other side.
Yeah, absolutely. Yeah, and not to take away from the suffering that's involved, but, it can be a positively transformative experience with the right support. Is there anything else that I haven't brought up that you feel like you really want to add to this discussion?
One thing to remember that's helpful when you have chronic illness is flexibility, self compassion. There's a story that I always tell, that my 100% today is different than my 100% tomorrow or yesterday. And I always give the example of when I was sick with the flu, my kids were sick with the flu. My value is my family, and they're very important to me. That relationship is very important to me. But man, when we're all sick with the flu, all I can do is quarantine us in the living room and, throw Gatorade and crackers and whatever at us all day. And that's my 100% for that day. And I feel really good about that. There's other days where I can, give really nutritious meals, make sure they're sleeping well, do all of these things. And each day is different. We tend to compare to other people so much. And we really do ourselves a disservice when we're doing that. So I think just, having that self compassion is really important, and spending the energy that we do have on things that matter. So I guess that would be what else I would say.
I love that. Thank you. I think we do put a lot of pressure on ourselves to, particularly if we're dealing with chronic health issues, to keep up with everybody else. We all do put these expectations on ourselves, and self compassion is key. Well, thank you so much, Lyndsy. Thank you so much for sharing your experiences and your knowledge.
Thank you for having me.
I have no doubt that this is going to speak to a lot of people who are going through these kinds of experiences. Thank you for joining me for this insightful conversation with Lyndsy Chavarria. Next time, we're going to be changing track a bit, and I'll be speaking with research professional Dr. Paul Giacomin. We're going to be talking about some fascinating research that he's been involved in that asks the question, can worms cure celiac disease? Not for the faint of hearted, but I hope to see you then.